a gun stock deformity, again due to an old fracture. Question 120. What is the diagnosis? Avascular necrosis of the body of the talus, secondary to a fracture of the neck of the talus. The main blood supply of the talus, as with the scaphoid and the head of the femur, flows from distal to proximal. A fracture of the neck of the talus may therefore cut off the blood supply to the body. Name the major complication. Collapse of the talus with osteoarthritis of the ankle and subtaloid joints. Briefly discuss the treatment. Early internal fixation of this fracture with a compression screw with non-weight bearing for at least 3 months. Established avascular necrosis of the body of the talus will probably require a pantalar bony arthrodesis, which is an arthrodesis of the calcaneus to the tibia, best performed with a Huckstep titanium locking compression nail. Question 121. This injury was sustained after a severe fall on the hand from a height. Describe the injuries in this X-ray. Dislocated elbow. Galeazzi fracture dislocation. This is a fracture of the lower radius with dislocation of the lower radio-ulnar joint. Chisel fracture of the distal radius into the joint. Name the nerves possibly injured here. The ulnar and the median nerves. Question 122. What is the diagnosis? A Smith's fracture or a reversed Colles fracture. Discuss the initial management. A Smith's fracture can prove difficult to reduce. It should be held in full supination and dorsiflexion in an above elbow plaster for 6 weeks, or internally fixed with a T-plate on the palmar aspect. Discuss the complications. Malunion, Sudex atrophy, osteoarthritis of the wrist. Question 123. List the features seen and discuss the differential diagnosis. Wasting of the muscles of the shoulder girdle with subluxation of the glenohumeral joint, and wasting of the triceps and biceps, forearm, and the small muscles of the hand. The most likely diagnosis is a flail arm due to a brachial plexus injury. The differential diagnosis would include an upper motor nerve lesion involving the anterior horn motor cells, such as in poliomyelitis, which is wasting but normal sensation. In an upper motor neuron lesion, such as a stroke, there is paralysis but little or no wasting or sensory loss. Give 2 common traumatic causes for this condition. Most brachial plexus injuries are motorcycle accidents. Neonatal cases are usually a traction injury during difficult labor. What deformity will develop over time with this injury? How can it be prevented? Flexion contractures will develop and can be avoided by moving the limb regularly through a full range of movements. Question 124. Describe the fracture in a middle-aged woman which occurred when she was walking upstairs. This is a partially displaced oblique fracture of the midshaft of the femur with a lytic area around the fracture site. This is a pathological fracture due to secondary deposits from carcinoma of the breast. What etiological factors should be considered with this fracture following minimal trauma? Causes of pathological fracture include metastatic tumors, generalized bone disease, osteoporosis and Paget's disease, osteomyelitis. Discuss the treatment. Treatment is with a Huckstep or other type of titanium locking intramedullary nail, followed by radiotherapy and hormone therapy. Postoperative hypercalcemia is a potentially lethal complication in secondary deposits due to carcinoma, and this must be corrected preoperatively and watched for postoperatively. Question 125. Name the condition seen in this elbow. Myositis ossificans or traumatic ossification due to an unreduced dislocation of the elbow. List some other sites affected. After hip dislocations, supracondylar fractures of the humerus, and prosthetic hip replacement. How has this condition arisen? The excessive calcification and ossification was probably due to repeated passive stretching of the elbow in an effort to achieve mobility, with further damage to periosteum and muscles. Myositis ossificans is more common in patients with nerve and head injuries and in those with a predisposition to osteoarthritis. Question 126. This 28-year-old man had an unfortunate accident in his garden. Describe the injury and the cause. The first and second toes have sustained a blade-cutting injury with an open fracture into the first distal phalanx. This was a result of the patient using a rotary blade lawnmower while barefoot. What is the first aid management? Local pressure with application of a bandage and elevation of the limb. It then requires debridement, suture, tetanus toxoid, and intravenous antibiotics. What are the likely complications? Shock, blood loss, and infection with osteomyelitis. Question 127. A young man with a severely comminuted fracture of the radius and ulna several months ago now presents with complications. Name this condition and describe the deformities seen. Volkmann's ischemic contracture. There is shortening of the long flexors, flexion of the fingers, loss of bulk of the small muscles of the hand, especially the thenar and hypothenar eminences, fibrosis, and contracture of the forearm, and an amputated fourth finger. Also note the malunion of the forearm fracture. What structures have been compromised? Neurological damage to the ulnar and median nerves, vascular damage and infarcted muscle replaced by inelastic fibrous tissue. List the symptoms and signs of ischemia in the forearm following a severe fracture. Another patient illustrating pain, paresthesia, paralysis, pallor, and a loss of pulses. Question 128. What is the diagnosis and the most likely cause? A severely comminuted open fracture of the ankle and lower tibia and fibula due to a motorcycle accident. What are the treatment options in a 20-year-old? Internal fixation to restore the stability of the joint. Alternatively, external fixateurs, or a below-knee amputation for associated severe vascular and neurological compromise. Also, general treatment including tetanus toxoid, prophylaxis, intravenous antibiotics, and blood transfusion. List the complications of this injury. Neurovascular damage, skin damage and osteomyelitis, associated fractures and soft tissue damage, long-term deformity, stiffness and osteoarthritis, gas gangrene. Question 129. Describe the injury in a 23-year-old African woman and give a likely cause. Posterior dislocation of the left hip. Ring fracture of the pelvis with a fracture of the left superior and inferior ischiopubic rami. Disruption of the sacroiliac joint. Anteroposterior or lateral deforming force, such as occurs in a motor vehicle accident. List the important complications of severe fracture dislocations of the pelvis. Intra or extraperitoneal rupture of the bladder, sciatic nerve injury, massive retroperitoneal hemorrhage, damage to the rectum and bowel, and osteoarthritis of the left hip. Other associated injuries include the spine, head, chest, abdomen, and the limbs. What are the multiple small opacities over the pelvis? Beads sewn in a dress of the woman, which have not been removed prior to X-ray. Question 130. Describe the diagnosis in the X-ray. There is an abnormal globular appearance of the humeral head in this AP X-ray, the typical light bulb sign. The patient has a posterior dislocation of the shoulder. This is uncommon, but occurs sometimes in patients with epilepsy and is often missed. What are the clinical features? The arm is held internally rotated and external rotation is impossible. There may be flattening of the front of the shoulder, often obscured by swelling. How can the diagnosis be confirmed? A lateral X-ray and a beta AP X-ray will confirm the diagnosis. Question 131. If seat belts and head restraints are not used in a car, describe the injuries more likely to be sustained by A, the driver, fractured sternum from the steering wheel, B, the driver and the passengers, head, chest and abdominal injuries, fractured patella and femur, posterior dislocation of the hip, crushed fracture of the thoracic and cervical spine with neurological damage, multiple limb fractures with neurological, vascular and cutaneous damage, pelvic fractures with severe bleeding, bladder and sciatic nerve damage. Question 132. What is the diagnosis of this condition in a young man? An old, severely comminuted fracture, dislocation of the surgical neck of the upper humerus. Note the sclerosis showing that this fracture has been present for some time. What complications should be looked for. Injury to the circumflex or axillary nerve, and perhaps other neurological and vascular damage. The fracture may have been compound with secondary infection. How should this be treated? Extra-articular arthrodesis of the shoulder is probably the best treatment in a young man with about 60 degrees abduction, 30 degrees forward flexion, and 30 degrees internal rotation. In the elderly, a shoulder replacement should be considered if the circumflex nerve is intact. Question 133. What is the diagnosis? Acute slip of the femoral capital epiphysis on the left side. In 2/3 of cases, it is a gradual process, while in 1/3 the onset is sudden. Note the prominent lesser trochanter, indicating that the leg is externally rotated. What are the likely clinical signs? Pain, limp, limited abduction and internal rotation, and increased external rotation. The leg externally rotates on flexion. What treatment is indicated? Pin in situ. Consider prophylactic pinning of the opposite hip. Both hips are affected in approximately 50% of cases. If the condition has been present for some time, an osteotomy to compensate for the slip can help. Question 134. Name the injury seen here. The X-ray shows a slightly displaced fracture of the acromion. Is the injury recent or old? The fracture is recent, as no callus formation is seen on the X-ray. How may this fracture be simply treated? A triangular arm sling is worn for 1 to 2 weeks, followed by active exercises. Question 135. Why was this patient admitted to hospital? Extensive burns. If burns cover more than 10% of the body, the patient must be admitted to hospital, especially in the case of children. Other indications for admission include all major full-thickness burns and burns to the head, neck, and perineum. Outline a simple fluid therapy regime. Intravenous fluid therapy in all burns over 20% of body area in adults and 10% in children. In the first 24 hours, crystalloid infusion at the rate of 20 mils per kilogram in the first hour, and measure urine output. If this is less than 0.5 mil per kilogram per hour, increase the drip rate. Blood transfusion and plasma infusion may also be necessary. In the second 24 hours, high protein and albumin diet with oral fluids. What are the common complications of this injury? Infection, toxemia, and renal failure. Contractures and deformity. Venous thrombosis and embolism. Contracted joints, especially the hands. Question 136. Name the eponym by which this condition is known, and give 2 other sites where this type of lesion can occur. Olecranon bursitis, or student's elbow. Other sites include prepatellar bursitis, housemaid's knee, or infrapatellar bursitis, clergyman's knee. What is the likely cause? Constant friction and trauma. Outline a simple plan of management. Firm bandaging, avoid friction, give antibiotics and drain if infected, excise the bursa if necessary. Question 137. A tear of the medial meniscus, including the posterior horn, the so-called parrot beak tear, excised in the past by open operation and now by arthroscopic meniscectomy. Describe the mechanism of injury. The tear is usually caused by a twisting strain while weight-bearing, and therefore commonly seen in football and in skiing. What is useful in the clinical history? The history may include a painful knee effusion, inability to fully straighten the leg, an unstable knee, and a click due to catching of the torn meniscus between the tibial plateau and the femoral condyle. Name the other structures that may have been damaged in the knee. The medial collateral ligament attached to the meniscus may be damaged, as well as the anterior cruciate ligament. Question 138. An elderly man presents with pain on abducting his right arm and a history of a fall onto his shoulder. What is the differential diagnosis of this man's condition?